This is a sacroiliac joint fusion with Trident. First, we start in the lateral and we have to adjust first the sciatic notch here and here in better coordination. And you see, by using different part of the C-arm, we adjust and align them so they are well aligned. As well, the so-called ala need to be aligned. And then, as a matter of fact, here we draw this line, vertical is vertical, and we draw the shadow of the sacrum on the skin. We connect then the promontorium to the middle of the sciatic notch and draw that line. Our entry point to the skin is the middle of the sciatic notch, and at this point practically we start the surgery, which is about 7:06 a.m. We put the wire, which is a big wire, in the practically at S1, S2 area. Then we put a dilator to keep the space open. Then over the dilator we turn and put the sharp end of the wire, we used until now the dull end, and then hammer it in to keep the trajectory. The trajectory, now we go to inlet view. You see we have to turn the picture to get a nice inlet view where, and this is the outlet view. You see the S1, and we aim at or just below the S1 screw. And then once the K-wire is in place, practical surgery is done. At 7:10, the main screws start going in. We practically just turn it, no more tapping or drilling, just the screw goes in. Then in the inlet view we align the two outer window of the screw. Then we breach the cortical bone with the awl and then put the side screws in, and this is when the last screw is in. And practically, if you remember, we started at 7:06. At 7:16 surgery is done, the attachment is removed. These are the final views, and so we spend probably 2 more minutes to close a 1-inch incision on the lateral aspect of the hip.